I'm just not sure. Should we give it another minute before we start? What do you think?
You are at 5 o'clock right now.
Okay, well, we can go ahead and get started then, I think.
Yep, go ahead, Yara.
Okay, well, thank you everybody for joining today. It's great to see you all. Continue using the chat to introduce yourself, name, pronoun, city. I'm going to introduce myself a little bit because I don't know everybody here, and that's very exciting for me. Oh no, how do I advance the slides? Can I click it? Oh yeah, there it is. Okay. Sorry, I know that my computer is very loud when it clicks, so I'll try to avoid doing that. My name is Yara Changyit-Levin. My pronouns are she, her, and there's some information on my slide, but more relevantly, I'm the author of a blog called Thrill Seeking for Nerds Who Want to Change the World, and I'm also involved in several different advocacy organizations, especially Results. And if you haven't heard of Results before, we're going to talk about them several times throughout the webinar today. So just for reference, we're a nonpartisan movement of everyday people who are dedicated to advocating for the end of poverty. And that includes a lot of global health work right now. So that's why Results is going to come up a lot. Where's the chat? Okay, I got it. As a global health advocate right now, it's kind of an interesting and worrying time with COVID-19 because I'm used to working on epidemics that are not necessarily a huge issue in my country because I live in America. It's a lot of overseas work, but then at the same time, COVID-19 is in my backyard, affecting my family and we're quarantined. So it's a very interesting time to be working on all these different health issues. And that's why I wanted to start this webinar today with Dr. Pai. I'm very excited for that. So I'm going to go ahead and we'll talk about the objectives and agenda for today. So first, we're going to learn why advocacy matters, especially for global health and especially for young people. I know not everyone on this call is under 18, and obviously everyone can be advocates, but that's a group that especially is getting involved right now and really should be doing that. Oh, the lights are on. Okay, next we're going to talk about what advocacy actually looks like in practice. What kinds of actions are advocacy? How is that really different from like volunteering community service sort of stuff? And then once we've talked about what advocacy is, why we should do it, then we can look at current events, opportunities for global health action. That includes COVID-19 as well as other challenges we've been seeing even before that. And depending on how much time is left, there will be an opportunity for a Q&A for the last 10 to 15 minutes. And there will be chances to ask questions of the different speakers throughout the webinar as well. If you have like big picture questions or specific things that you can wait until the end to share, that would be great. Hi Tara and Glenn and people who have just joined. Hello. Okay, so with that, now that I think we've got a lot more people joined and we've gone over the agenda, I'm going to turn it over to Dr. Pai. He is the Director of Global Health at McGill University in Montreal and thus knows a lot about why global health advocacy is important. So take it away.
Thank you, Yara. Can you hear me?
Yes.
All right. So it's a real pleasure to be spending a little bit of my time to set the scene for Yara. She'll be doing most of the talking. But having been actively involved in global health advocacy for many years, I have a few ideas and reflections that I want to share with you. First of all, this is a picture of my students. And you can see they're all very active advocates for tuberculosis, which is the disease that we care a lot about within our group. And we take every opportunity we can to advocate for greater funding and resources and attention to TB. Can you move the slide, Yara?
Yeah, there it is.
So why do I think advocacy is necessary? So I'm a researcher, I'm a professor, and you would think that much of the time my job will end when I conduct a research study and I publish a paper. After almost 20 years of doing that, I've come to the realization that doing research, as good as it might be, publishing papers, and even if it is a very high profile, well done study, things don't necessarily change on the ground. So if we care that research, new tools, products, anything actually reaches the ground and actually reaches those who need it the most, I see no other option than to actually go beyond the call of duty in terms of just stopping with research to actually advocate for a real change to happen. For example, I wrote a piece last week on the devastation that COVID-19 can cause to people living with tuberculosis. But I didn't stop there. I took that piece, I shared it with WHO, Gates Foundation, Stop TB Partnership. We're hosting a webinar on this tomorrow. We are not going to sit by and wait for the devastation to happen. We are going to actively try and prevent devastation from happening. To me, that is where advocacy really comes in. It is a clear, explicit commitment that you're going to chase something to its logical conclusion. And I have seen enough to say that things just don't get done on their own. You got to be willing to roll up your sleeves, get your hands and feet wet, dive right into it, and chase it to wherever it's necessary for you to chase it. So take, for example, all the anxiety already about when the COVID vaccine becomes available, or if there's a better drug for COVID in the next few weeks. Will it only reach people who are rich and famous, or will it actually reach those who need it? Will it reach people living in poor countries? And I don't think we can allow any of these to be left to chance, because left to chance, nothing will happen. Only a privileged few will benefit. So if we care about something, we need to really step up and start advocating for it. And advocacy, as this picture shows you, takes many, many, many forms and shapes. Advocacy could be something as simple as writing to your senator, or here in Canada, writing to a member of a parliament, or writing an op-ed piece that I wrote on COVID, for example, or organizing a campaign. And Yara will tell you more about what that means and what kind of shapes and colors it takes. But it is not a singular entity. It comes in a whole spectrum of different entities, and each of us can decide which of those are best suited to our life circumstances, our time availability, and our resource availability. But I think it would be safe to say that everybody can advocate, because there are some things that can take a second, a minute, and cost us $0, and we can still advocate. So I can't imagine a situation where somebody cannot advocate. Even going out and voting to the right candidate for in the right election is a sign of advocacy. Next slide. So I'm going to give HIV/AIDS as a fantastic example of how advocacy played an incredible role. I work on TB, and anytime I go to an HIV meeting or I speak to people who've been working in HIV, I'm just blown away by the amount of enthusiasm, the amount of just passion and ambition that folks in HIV bring to their field. It is their single-minded advocacy for 2 decades now that has broken the back of the AIDS epidemic, which has made antiretroviral treatment available to larger and larger number of people all over the world, including the poorest countries. They managed to turn HIV/AIDS from a definite death sentence to a condition with which people can live a fairly long and normal life, and that is a wonderful example that any of us who care about advocacy should look up. Next slide. So here I wanted to share this absolutely incredible book that I read a few months ago. It's called How to Survive a Plague by a award-winning author called David France. And it also appeared as a movie. So if you can't find the book, please try and track down the movie. My university library actually gives me online access to the movie. um, Incredibly powerful book and movie, and I wrote an entire piece just on this book after interviewing the author as well as several of the people who appear in the book. Next slide. And in that piece that I wrote for Forbes, which is free for you to access, I basically said AIDS activism is one of the best playbooks anybody can read for global health advocacy. Whether you want to advocate for gun control, whether you want to advocate for gender equality, whether you want to advocate for COVID vaccines to be more affordable, whether you want to advocate for climate change, it doesn't matter what you want to advocate for. I think the HIV/AIDS playbook in advocacy is a necessary reading, in my opinion. Next slide. So what is it that made AIDS advocacy so incredibly powerful? So here's what the author of the book, as well as many of the key players in that story, told me when I interviewed them. And I've given you a lot more detail in my piece that I wrote in Forbes. First is AIDS advocacy did not appear in a vacuum. The early days of the AIDS advocacy, they built on other movements. I mean, clearly in places like New York and San Francisco, many of the people who were affected by HIV/AIDS were gay people, and they built on an already developing gay rights movement that was unfolding in those geographies. Civil rights, they built on the civil rights movement. So civil disobedience, for example, was one of the cornerstones of the HIV/AIDS activism. And in places like South Africa, for example, where Treatment Action Campaign and other groups took off on AIDS advocacy, they built on the anti-apartheid struggle. So where possible, a powerful advocacy movement will catapult and build on other movements that are already in place. Next slide. The other thing that I learned by reading this book is that they use the fear and outrage of people who were affected to great effect. As Larry Kramer has famously said, what makes activism work is that the patient's anger and fear, you got to be able to capture that, bottle it, and use it. So this means if we do not engage people who are most affected by a disease, and if advocacy is coming from people who are really not affected by the disease, I'm not convinced we can be very effective. Here is where I fear that my own field of tuberculosis has done a very poor job. If you compare AIDS advocacy with TB advocacy, we rarely bring people who've survived TB, people who are living with TB, to the forefront, give them put them in the driver's seat and use their fear and outrage. TB advocacy the whole field of TB is very biomedical, dominated by scientists like me or policymakers like me, and we've not suffered TB. And I think that is a fundamental difference. If you really want to be effective, you got to find people who are most affected, and you got to give them the mic and step back. And I think that's where HIV/AIDS advocacy really stood out, in my opinion. Next slide. And they mobilized and organized. So again, it's easy to kind of do a one-off march or write one letter and just stop with it. But if you want sustained advocacy over many, many years, and if you want to actually see it to its logical conclusion, then you need to be a lot more organized and mobilize a large number of stakeholders, which is what people working in HIV/AIDS did. They sustained their advocacy for the best part of more than a decade, and that is not easy to pull off unless you're effective, you're organized, and you're mobilized. And they raised resources. They did not just do it banking on the goodwill of a handful of people. They raised money, they raised resources, and here again, you see a huge difference between TB and HIV. We ask TB survivors to come to our meetings, and we don't even pay them for their time. We think that they will just contribute out of their goodness of their heart, and we don't have professionalized TB advocates who can do the kind of advocacy that HIV/AIDS people have done. We've simply not invested in TB advocacy, which is a big difference between HIV and TB advocacy. Next slide. and they, as the book beautifully shows, they paid good cop and bad cop. They had a whole bunch of advocates taking over FDA, taking over pharma companies, storming into NIH, and creating heck of a ruckus, while a few of them were accepted inside inside committees, inside high-profile working groups. So they managed to have both the exterior agitators and the interior scientist, civilian scientist, to also do the work. And that's how I think they managed to achieve things that very few people could do, which also meant, next slide, they had to really work hard to learn HIV science. The early days of the HIV epidemic, HIV patients knew more about HIV science than most HIV scientists knew. They read every paper they could read. They got involved with drug trials. They, in fact, wrote the first ever agenda, research agenda on HIV/AIDS treatment. They decided what science they wanted, and they wanted to be involved in every single aspect of HIV science. Every product development, every guideline, every clinical practice effort, they wanted to get involved, which meant that they really had to know their stuff. If you combine solid scientific evidence-based thinking with advocacy, that is a whole another level of power. So if you're a climate advocate, you should really know a lot about climate change. And you just simply cannot go into these meetings without knowing your stuff, because then it's very easy for someone to pull down the idea with some completely irrelevant or ridiculous comment. So knowing your stuff is actually very critical. Next slide. And then lastly, they were unafraid, HIV advocates, to get into the weeds. They wanted to influence R&D funding. They wanted to get involved with drug trials and community advisory board. They wanted to get involved with how FDA was approving new HIV medicines. They wanted to make sure HIV medicines were not outrageously priced. They cared about access. They got involved with guideline development. They did not stop with just saying, please do something for HIV. They actually made it happen by getting involved in every single aspect of the entire spectrum of work in HIV/AIDS. There was not a single thing about HIV/AIDS that they did not get involved, which is why nothing about us without us became their motto. They did not. You could not organize anything in HIV/AIDS today without people living with HIV as an integral part or even the lead on that particular work, which is again very different from TB. We have so many TB conferences where there isn't a single TB survivor on the panel, and somehow we have forgotten one of the most central figures in the TB epidemic, that is people who are suffering from TB. Next slide, which I believe is my last slide. And so this is to just share that when I meet really young advocates, and I've shown you a few of them at the bottom of the screen, TB survivors who are in their 20s, they're all survived TB. Some of them nearly died of TB, and they're very powerful advocates in TB today. And there are young advocates like Yara, Summer, and many of you on the phone as well. To me, I think young advocates give me huge hope. And why do I say that? Um, I'm really pessimistic today about the adults, and I find and in fact, Yara, move it to the next slide, please. My last slide, which this picture of Malala and Greta Thunberg is kind of symbolic of the hope I see for the future. And the reason why I say that is that everywhere in the world, if you look around you, whether it's gun control in America, whether it's the climate crisis, whether it's the response to the COVID-19 pandemic, whether it's pharmaceutical pricing or access to medicines, it really doesn't matter. I'm afraid the leadership and the commitment is simply not coming from adults. In every way, in every form or fashion, adults are letting down the youngest generations. And I think climate crisis is one of the best examples I can think of. I simply do not see adults solving these problems. I do not see them solving the gun control crisis. I just cannot see, because they are too darn vested in their own lives and their narrow self-interest. Yeah, and they are so narrow in their thinking that they cannot think beyond their next term or getting re-elected in a few years, that they are simply not even willing to consider the future of humanity as a race. Youngest people, I find, are the clearest thinking people today. And at some point, at some level, I see no hope for the future other than to hand over the reins to the youngest generation. So I'm thrilled that many of you care about advocacy, because I think the world needs it. And it's a little sad to say that adults are simply not delivering, but that's the honest truth as far as I can see it. And it's asking a lot for young people to take on some huge burdens in the coming years. But young people have already seen this. I think young people perceive that the adults are simply not going to get things done, which is why, whether it's gun control or climate change, they've decided that they're going to have to fix this bloody mess that the adults have put them into. And that's why millions of young adults marched on the streets for Climate March. And I think that is a sign that that's the wave of the future. So I'm grateful to all of you and thankful for you for your time. And I'm happy to hand back to Yara and then take any questions at the end.
Okay, thank you so much, Dr. Pai. If any of you have questions for a real live global health expert, please put them in the chat or save them for the end. As you said, I think that would be a really great opportunity. So now that we've heard about historically what advocacy has done for global health and so many other issues why it's needed, especially for young people, let's talk about what exactly we mean by advocacy, because that's a pretty nebulous term. Generally, it's just anytime you're standing up for something or others. But in my experience, the kind of definition that I use when I'm trying to think about are my actions advocacy is, are my actions building relationships with others to make meaningful policy changes together? That's generally anything that falls into that category I would think of as advocacy. And I apologize, my computer clicking is really loud. I'm not really sure what else to do about that. So what does that actually mean? So the kinds of people we should be building relationships with, often these partners include members of parliament or members of Congress, depending on what country you live in. So Congress and Parliament, they have a responsibility to listen to their constituents. Those are the people they've been elected to represent. And this means that every message that you send, whether it's a phone call, a letter, an in-person visit, things that you have the right to do no matter how old you are, you have a right to contact people who represent you. Every message like that will get recorded in a database. And that database helps every office inform their positions. How many people support this? How many people oppose that? And obviously, not every lawmaker will listen to you on every issue. For things like when a lot of Americans were trying to impeach our president, the party affiliation determined that a little more than if 10 middle schoolers called about it. But it's completely worth doing, because by writing letters and making phone calls, you can make your voice heard in a matter of minutes. And on a lot of issues, it actually does work. So when you do this, especially combined with in-person visits, you can affect change as a persistent young leader. What I found is that building bridges while not taking no for an answer gets us a lot further than animosity. So you can see on this slide a couple different examples. On the left, you have Congresswoman Jan Schakowsky from Illinois and my mom in a face-to-face meeting. Congresswoman Schakowsky is a great leader for global health in Congress, and she has been for a long time. But when she hears from constituents saying, yes, keep doing what you're doing, here are some suggestions we have for you, try this, it gives her an excuse to do good work for global health. They simply can't do it if there isn't constituent support. Then on the top right, you see 2 senators with 2 little girls, and that's my sister and I, ages 6 and 8, the first time we went to DC, because there's no limit to being an advocate. We went there armed with many handwritten letters from our friends. And on the bottom right, that's a picture of Volunteers with Results Canada lobbying their parliament. A lot of countries allow you to do this, and if you have that right, it's a really good thing that we need to take advantage of. But then back to the definition about building relationships with others, that doesn't just apply to Congress and Parliament. It's also about the friends, allies, and partners you make along the way when you reach out to your community. So writing letters and social media posts by yourself is a fine way to go. And if you're doing that already, I applaud you. But with a team of fellow action takers, you'll find support, inspiration, and also a greater impact as a diverse group of voices. Advocacy is about being an educator, a leader, and an ally for others, like Dr. Pai talked about, passing the mic to people who have been more affected than you. And when you're trying to get others to take action with you, an important thing about advocacy is it's not just about votes. There's always another level up for someone to take. So if your friends already support the same political candidates as you, ask if they'll write letters. And if they write letters, why not come to a meeting? And if you yourself are just getting involved, it's great to take a buddy with you. I have done that plenty of times. And then you get 2 new leaders. And that's a great thing. So when I think about this kind of like empowering others form of advocacy, I think of my friend Shruti, who is creating a letter writing event as her Girl Scout Gold Award, or my sister Summer, who taught our young neighbors, their ages 6 and 8, about global health because they were interested. And you can see them in the bigger circle picture, they're writing letters. On the bottom left, you see Results Canada, and they have a great community of volunteers already. And the smaller picture, that's a circle with the red room. Not the red room as in Marvel, that's weird. This is my colleague Sri Jaladi, and he and I both lead workshops for different advocacy skills in our community. So there's a lot of forms that this can take. Next slide. So as you can tell, there are a lot of actions that all count as advocacy. And my sister Summer is going to go over a few of these later. I just want to preview by saying there is something out there for everyone. So if you want to get outside and get moving, then pick up a sign and go protest, or go lobby in person at the office of your member of Congress or Parliament. If changing minds from home is more your thing, then it's a great idea to write letters directly to your elected officials, drop them in the mail, or you can write letters to the editor in newspapers, op-eds like Dr. Pai does. And you don't have to be a global health expert to do that, by the way. Almost everyone in my family has written letters to the editor at some point. And that's a great thing you can do just from your bedroom with a computer. I've also talked about community outreach and education. That's very important. So if you are in a public speaking class at high school or middle school and you give a speech about one of these issues, that's also advocacy. There are so many ways to do advocacy, and there's really no limit. It's, again, any time that you're just building relationships with others, talking about the issues. Another point I want to make is that teenage voices are especially powerful. You may think that because we're not old enough to vote, we don't matter as much to the government, but lately we're seeing more and more that younger volunteers can get really far even without a vote. And this is because today we are currently the backbone of a lot of political movements, as well as being their future. We're not just one or the other. We are going to be here for a long time. And Congress and Parliament know that. It can even make them nervous sometimes. But for something like global health, if we are very clear about what we want and we start two-way conversations with lawmakers in power, then they will see an opportunity not to alienate the young people. And we're not trying to fight them all the time if they're the people who can get what we need. We just want to have conversations, and politicians just want to be liked a lot of the time. So respectful conversations, especially for global health, have worked in the past and they will continue working. Okay, but a question that I'm thinking about a lot is, what now? We have coronavirus, and in this age of social distancing, it can appear that momentum for advocacy is grinding to a halt. There are no meetings, no rallies, no conferences, and no youth summits. And on top of all that, we're all stuck at home. So why would anyone choose now to get involved in something new? I suspect since you're all on this call, you kind of have an answer to that already. Obviously, COVID-19 is really bad, and it's terrible that this is happening, but since we're all stuck here anyway, we do have an opportunity to turn our social isolation into solidarity, especially when everyone now realizes the impact of pandemics. We can see the weaknesses in health systems that were already there before, that TB patients weren't getting a voice, that current systems weren't reaching the most vulnerable communities. And so even beyond COVID-19, we see now that global health advocacy really, really matters. Even before the current pandemic, we also saw lots of worry and negativity in politics. And advocacy is a way to take apathy and turn it into urgency and good outrage. You can take your self-doubt and realize that, hey, I can make a difference, and fear becomes practical hope. Personally, advocacy just helps me cope with everything that's going on. I have a really long spring break and not much to do over spring break, and besides just thinking about things and worrying. But then if I dive into advocacy, I feel like I'm making a difference. I know I'm making a difference, and it honestly makes me feel better. So advocacy is good. It's good for us. It's good for the world. What does it look like, though? Because I mentioned things like in-person meetings, and we've seen pictures of people holding signs and rallying, and that's like not allowed now. That's a big no-no. Social distancing, stay away. So it means that we're going to be moving online a lot, like this meeting here. Things like writing media, making phone calls and emails, that'll continue as usual. But in a lot of other areas, we have to adjust our plans. But this forces us to get creative. And creativity is something I see in a lot of young advocates today. So this gives me a lot of hope. And speaking of creative young advocates who give me hope, here's my sister Summer, and she's going to talk to us about everyday advocacy as an 8th grader, what that looks like to her. So Summer, are you ready to?
Yeah.
Oh, good, you're here. Okay, go ahead, Summer.
Hello. So, my name is Summer, and I'm in 8th grade. I've been involved with my city's results group for a really long time now, and I really believe that advocacy is a great way to just take the step and find your voice. Taking the first action is especially daunting, though. But once you actually try it, future actions only get better. The very first action I took was writing a letter to Congress. Letter writing is a really good way to be engaged with the government for a couple of major reasons. Many organizations provide information and resources, so you don't have to struggle with the exact language. It's hard to feel strongly about issues like global health, but not even know where to start. So with that information, you can delve deeper into specific legislation that you believe in. An action that I also take with letter writing is actually calling Congress on the phone. Leaving voicemails or talking to the aide at the office is a very quick and easy way to let those offices know how their residents feel. This type of advocacy is probably the type that I do most often. In the midst of school and after-school activities, advocacy can often be pushed to the back burner. So even if you don't have time to write out an entire page of well-formatted, cohesive sentences, a quick call with an important message will always have an impact. And the same thing that for letters is true for phone calls. Many groups specifically write out the request in their emails, so you don't have to guess on what to say. And since they can't see you through their phone, there is no shame in reading from a script. If you want to add your own personal touch, that's great. So those were two forms of advocacy that are great for personal messages and faster action. But in my opinion, the biggest, most epic of all time actions would probably have to be face-to-face meetings. These are meetings where constituents go to their Congress members' offices and talk about issues that are important to them. Imagine you are a congressperson. Bear with me. You're working to make your residents happy and maybe not always considering what legislation can help on a global scale. If you hear from your staff that a group of people from your district came into that office and said that they believe in global health, that certainly makes an impression. Aides and Congress members are people too. Face-to-face meetings are the next level of this kind of advocacy and the most exhilarating. Meeting the member of Congress in person is kind of like meeting a celebrity, but they work for you. Now, given that there's a pandemic going around, this probably isn't the safest idea right now. But as this persists, I'm guessing that more and more members will probably switch to video calls. My local representative is already self-quarantined, and she's doing all her work from isolation. Even before COVID-19, we regularly have video calls with Representative Clay and get him to sign on to bills we're advocating for. So just to recap, letter writing is awesome for first-time actions. That personal touch of your distinct handwriting can show those staff members that their residents care, not just some programmed robot. I also find that colorful gel pens can really add to an already great letter. Second, phone calls are a fast, on-the-go action and great for passing between sports and school. And finally, lobby meetings are the mega action. You don't have to be an expert about the legislation either. If you know why you care about global health and what you want Congress to do about it, you're set. So I hope that helps, and Yara will have some examples on how to get started after this meeting. So thanks.
Thank you, Summer. That was awesome. And if you have questions for Summer, again, leave them in the chat or for the end of the session. The next part is, now that we've talked about what is advocacy, why does advocacy matter, what does advocacy look like, what can we actually advocate for today? And so if Sri Jaladi is on the line, I'm hoping that he can give us a global health update, but I didn't see his name go by. So
Hey.
Sri, are you here?
Hello?
Oh, there he
I'm
is.
here.
Awesome. Okay, take it away.
All right. So, well, first off, thank you, Yara, for having me on. It's an honor, and to be able to be here and give everyone a global health update. Yeah, could you just move the slide? Sorry. Yeah. So I think the first thing on everyone's mind right now is the COVID-19 situation. It is a pandemic. It has spread to several countries and a lot more around the world. We did refer to TB and AIDS also as pandemics, but this is specifically an outbreak because of the very rapid spread of the virus. I know there are still some questions on exactly how it differs from the regular seasonal flu. The very first thing is that on average, someone with the COVID-19 virus will spread the same virus to 2 to 3 other people, while someone with the flu will spread that to just on average 1 other person. And that's why we get the sort of exponential growth of COVID-19. Along with this, the death rate of COVID-19 is much higher than that of the flu. It's about 2 to 3%, while the flu is just about 0.1%. And the flu is usually spread over the season. So there are specific times throughout the year where the flu is more prominent, while with the coronavirus, there's still a lot of questions that need to be answered about that whole situation. And then could you go to the next slide? Thank you. So talking about the exponential growth, pandemics such as the swine flu and now the coronavirus grow in an exponential curve, similar to the popular lily pad math problem. So the question is basically, at the 0th minute in a pond, there is 1 lily pad. And at the end of every minute after that, the number of lily pads doubles. So at the end of the 1st minute, there's 2 lily pads. At the end of the 2nd minute, there's 4 lily pads. At the end of the 3rd minute, there are 8 lily pads, and so on. So the question is, at what minute is the pond half covered with lily pads? If you have an answer, you can just sort of put it in the chat. It can be a little interactive. Yeah, so at the 59th minute, just 1 minute before the 60th minute, the pond is half covered with lily pads because it is doubling every minute. Now, what's even more interesting to look at is how much of the pond is covered at half the time. So at 30 minutes, how much of the pond is covered? Does anyone have any guesses? So it's actually only about 0.0031% of the pond that's covered at 30 minutes. So you can see that halfway through the whole timeline of this, there isn't too much that's covered. However, throughout the next 30 minutes or throughout the next half, there's a lot that's covered, and that sort of illustrates exponential growth. Could you go to the next slide? And this graph is a good indication that there is exponential growth of the coronavirus within the United States. It is a bit outdated, but the rest of the graph throughout the next days has continued to show this exponential growth. Could you go to the next slide again? Could you go to the next slide again? Oh, okay. So what exactly does this mean? In terms of the medical care that people receive, if we, oh no, it's no worry at all. So in terms of the medical care that people receive, if we go back to the graph, we can see that in the red graph, it had a chunk of the graph that was over the medical capacity or the healthcare system capacity that we can offer. Now we want to flatten this curve into the blue curve, where we can see with protective measures, and the peak and all of the curve is below the healthcare system capacity. So if we don't take enough protective measures, there will be a set of population at some time which will be over the healthcare system capacity, meaning that some people who need the care won't be able to get the adequate amount of care that they need. However, with protective measures, we can make it so that everyone who needs care from COVID-19 can get that care that they need. And that's why it's important, because it limits the number of deaths that occur. And so now, the Global Fund is a fund that is working to help end AIDS, TB, and malaria around the world. And it is something that Results heavily advocates for. And especially at these times, it is important to have global health programs around the world to make sure that the global infrastructure in terms of health is good, because it is a world effort to fight COVID-19 right now. And specifically, the Global Fund is investing in a better future for the whole world to fight off these diseases. And finally, looking at the Gavi. So currently, COVID-19 actually does not have a vaccine in play. And that's what's made it so difficult to sort of control it. However, there are many diseases that actually do have vaccinations, and yet there are many people, especially in lower income countries, who aren't able to get these vaccinations, and there are many people who continue to die. And this is simply just unacceptable. And that's why the Gavi, the Vaccine Alliance, works with world organizations such as the WHO and the World Bank in order to help get vaccinations to countries that need it, mainly lower income countries, in order to help their populations become vaccinated and to allow the world to become more healthy overall. And it is important that everyone get these vaccinations that we here in the United States are very lucky to get at a very young age. And just as a final note, global health programs such as the Gavi and the Global Fund are very important because they help build health infrastructures in countries around the world. And especially at times like this, where there are outbreaks such as COVID-19, it's important that it's a world effort and that everyone is able to actively respond to these situations and help combat the current situation. Thank you.
Thank you so much, Sri. That was awesome. Wait, am I unmuted? I can't talk. Okay, yeah, I can talk. Okay, that's cool. Thank you, Sri. So just to recap all the information that he gave us, we have COVID-19, and that's far from the only pandemic. We've got HIV/AIDS, tuberculosis, lots of vaccine-preventable diseases. And with all that, we can and should advocate for whichever of those issues speak to you. But today, for an example, I want to talk about the Gavi, the Vaccine Alliance, and what we can do today to pick up the phone and call or write a letter about that. So as Sri mentioned, Gavi, the Vaccine Alliance, is helping to vaccinate almost half the world's children against deadly and debilitating infectious diseases. And as part of its mission to save lives, reduce poverty, and protect the world against the threat of epidemics, Gavi has helped vaccinate over 760 million children in the most vulnerable regions of the world. I mean, that number blows my mind, 760 million. And this is great because it's helped prevent over 13 million deaths in the 20 years that it's existed. As Sri said, that we don't have a vaccine for Gavi, but Gavi is going to be really important for fighting COVID-19.
You don't have a vaccine.
Oh yeah, there's no vaccine for COVID-19. There are vaccines for other things. My mom is reminding me that I said that wrong. Yeah, there's no vaccine for COVID-19. But by building up health systems, we can be prepared for anything. And once a COVID-19 vaccine is ready, Gavi will be on the front lines of distributing that someday. Another thing I wanted to mention about Gavi was how they really empower countries to become self-sufficient and fund their vaccine programs themselves. So to date, 15 countries have already transitioned off of Gavi support. That includes Cuba, Indonesia, Mongolia. They used to need Gavi support, and now they can do it themselves. And that's a really important thing in international relations and sustainable development that I'm very excited to see. So now we want this to continue. We need this to continue. But with all the panic about coronavirus happening, I am very concerned, with good reason, that funding for Gavi could get left out of a lot of countries' priorities. So what we're doing right now in the United States and Canada, and based on what I saw in the chat, I think everyone here is from either the United States or Canada, but there's something every country can do. I'm going to focus on those two, though, to make sure that Gavi gets the funding they need for the next 5 years. Gavi gets funded on a cycle of 5 years. They always have a pledging conference, and they get funding from the donor countries like us and private organizations like the Bill and Melinda Gates Foundation, and also the countries where programs like this are being implemented. On the slide in the top right picture, there's 2 mothers and 2 babies at a clinic in Uganda. Uganda receives Gavi support and is expected to contribute to that financially. But at these pledging conferences, all the world leaders get together and they kind of look at each other like, oh, what are you giving? What are you giving? And it's up to leaders like the US, UK, Canada to show people how much of a commitment we can and should make. If the US slacks off, the other countries will take their cues from that and we won't raise enough money. So the last time there's a pledging conference, we did get a strong US commitment. I don't remember Canada's number, but collectively we raised enough money. So I assume Canada did well too. Thanks, Results Canada. I'm sorry, I don't have those numbers. And on the top left, that's my family celebrating the last 7 billion pledge. We're coming up on another pledging conference this summer, and I don't know if it'll be online or postponed or what, but Gavi needs money, so somehow they're going to get it. And we need to make sure that it's enough to fund all the important life-saving work that we're doing. So in Canada, this looks like a 600 million pledge over 5 years is what Results Canada is pushing for. And it seems kind of technical and a little weird to be asking for these certain accounts of funding, but really any informed citizen constituent should be doing this. And I believe Summer has a link to Results Canada's tool in the chat that she'll put there. So if you're in Canada and you want to take action and haven't done it before, click on that link and it'll tell you how to write to your member of parliament. Meanwhile, in the US, we're also asking for a multi-year pledge, but it's going to look a little different how we're going about that. We're building support in Congress for Gavi using these things called congressional resolutions. And I know a lot of you have already heard of congressional resolutions, but just so that we're all on the same page, these are documents that are kind of like a Model UN resolution, if you know what that is. They're like petitions in Congress, and members can sign on to them, and if they get enough support, it becomes the official view of the US Senate or the official position of US House of Representatives. And the resolutions that we have are very important, and basically they do 3 things. They celebrate all the work that Gavi has done already for the past 20 years. They state how the US supports Gavi and we need that work to continue. And then it recognizes the importance of this next pledge, how important it is that we continue to pledge the resources and get Gavi what it needs, and that includes a multi-year pledge. So with these resolutions, you see these jumbles of numbers and letters here, HRES 861, SRES 511. Those are just the official bill codes for the 2 resolutions. And there's one in the House, one in the Senate, but they have the same sentiments. And we're asking senators and representatives in the United States to become co-sponsors. What that entails is just adding your name publicly, saying you support this. And it really holds a senator accountable for that. If they say that they support it, then we can follow up in future actions on global health, saying, hey, you signed this, well, you signed this other thing. And I can tell you it's a very effective tool. So when we call and write, we're asking for people to co-sponsor those resolutions. And I know we're all from a lot of different congressional districts, and some of us aren't even from the US, but if you are from the US, Google who your senators and representatives are, and if Summer hasn't already put them in the chat, there are 2 links to check if your elected officials are already on these resolutions. There aren't a lot, but some of them have already become co-sponsors, and if they are, call them and say thank you, because positive reinforcement is really awesome. And it's nice to do a positive action that's related to politics, because I know a lot of us get frustrated with politics. My representative, however, has not yet co-sponsored. And so, as an example, I'm going to call her office right now, and her aides probably won't pick up, so I'm going to leave a message and kind of give that as an example. So I'll stop the screen share now if that works. Oh, look at all these people. Hi. I'm going to call Ann Wagner. She's my representative, and we'll see how that goes. I'll be very surprised if they pick up because I think everyone went home. Oh, good. We have the links in the chat. That's awesome. die. Even if you have to leave a message, it still counts the same. It gets recorded when they listen to it later. So don't feel bad if they don't pick up, especially with people working from home.
You've reached the office of Congresswoman Ann Wagner. We're currently unable to take your call. Please leave your name, number, and a brief message.
Record your message after the tone. When you've finished, you can hang up or press 1 for more options.
Hello, my name is Yara Changyit-Levin, and I'm a constituent. My zip code is 63017. I would like Congresswoman Wagner to co-sponsor HRES 861. This bipartisan resolution reaffirms the U.S. commitment to global immunization through Gavi, the Vaccine Alliance. And since we're seeing right now the effects that pandemics can have, I really believe that co-sponsoring this resolution is the right thing to do, and it should happen as soon as she can. Thank you so much. And again, that's HRES 861. Have a great day. Ta-da. So that's how you call a member of Congress or Parliament. At this point, I've run out of things to tell you with lots of information. So let's do a Q&A now. You can take yourself off of mute to ask a question of me, Sri, Summer, Dr. Pai, anyone who's talked today. And you can also drop questions in the chat, and we'd be happy to do that for the last 10 minutes.
Absolutely brilliant job, Yara.
Thank you. Does anyone have a question?
And I've never seen a live call to a Congress representative. And I've never done one myself.
Oh, you should do one.
I've written letters to the Prime Minister, Health Minister, whatnot, but I'm just not done this calling business. So I learned something from you.
Yeah, calls are pretty great for teenagers because we're always on the go.
But why did you not leave your phone number for them to call back? Is that something you should have done,
because
or you don't?
I don't want them to call me back. Sometimes we'll do that, like in results, if we're having ongoing conversations with a specific aide, it's like, hey, could I talk to Hannah, please? And I'm the results volunteer who's been corresponding with you on this. Could you give me a call back? And like, that's something that we've done before. But if you just want to call so that you get tallied in the database and you don't necessarily want them calling you back, then I don't leave my phone number. But you can. Also, make sure to leave, I don't know if this is how it works in Canada, but in the United States, be sure to leave your zip code just so that they can confirm that you actually do live in the area they represent.
Melissa knows that.
Oh, Melissa knows that. Do you know? I don't know how Canada works.
I noticed, right, definitely we always encourage hi everyone. Melissa, I work at Results Canada. Thank you so much for doing this webinar. So certainly we encourage people to refer and use their postal code so that the members of parliament know that you are a constituent of theirs, certainly, yeah.
Thank you. That's awesome. Oh, I see questions in the chat. Okay, I saw a question from Wade about domestic production of medical supplies and equipment. Okay, so I'm not actually current on every single coronavirus related issue, so I'd be happy to talk more about that later. I think the best way to advocate for anything coronavirus related is to like find information on it and then like write out like 2 or 3 sentences about what you think Congress should be doing. Like I know that there's been a lot of votes in Congress lately about coronavirus, and that's why I didn't put a coronavirus related ask here, just because I wasn't sure if by 5 o'clock it would have passed or not. Is that a good answer?
You told them about Epic.
Oh yeah. Generally, if you just like introduce why you care about something, the specific problem you're talking about, and then just a yes or no request. They won't give you a yes or no answer, but you can apply that to any issue. I think that's just the best way to advocate for anything you're working on. Let's see, I see a question from Tara. What is the structure of a typical face-to-face meeting? Summer, do you want to take that?
I know that.
Okay, go ahead. Thank you, Tara, for your question.
I happen to know that. So with a typical face-to-face meeting, we've normally had them in DC because that's where they work. So it's most likely that you'll get one DC rather than in-town face-to-face meetings. But generally you come in and they really like to know about you because you're their residents. They want to know like who are the people that are coming to talk to them. So a lot of the first part of the meeting is sharing why you care, how you got involved with whatever organization you're coming in, and just getting to know them as well, because they have lives too, and they like to talk about it when given the chance. So that's kind of the first part of the meeting, and then you can get into the specifics of like what you came here to do, what problem is going on that you care about, why you care about it. Some of those roles are passed around over multiple people. And then at the end, you ask them and you request, like, kind of straight out, will you use the bill for all the reasons that we listed above? And like Yara said, they don't really give you yes or no answer because it's very members with them.
Oh, I don't know what that noise was. I don't know if anyone else heard that. Yeah, I agree with everything Summer said. I put in the chat just like the usual structure that we use is we assign different roles and you have like, we start with a personal story, whether we have someone with us who is a doctor or has been affected by the specific disease or something. And then we have like a personal story and then like the facts behind our solution. Why is our solution important? Why does Gavi matter? Or why is housing assistance important? Whatever it is. And then one person who's definitely going to make that request. A note about your congressional representative, Tara, because I happen to know which district you're in. She will grant face-to-face meetings, so she can give you a yes or no if you get to work with her in person. So usually we just like, yeah, it's a story, information, request, and most of all, it's just a back and forth conversation. Once you've established what you're talking about, they may have questions, you can answer, you can have questions for them. Yeah.
I have a question for any of you actually.
Okay.
I have a bad feeling this COVID crisis is going to lead to such big economic losses that every rich country is going to pull back on international aid or foreign assistance. And that means Gavi, Global Fund, it doesn't matter what you're talking about, their ability to respond to any of this is going to be severely limited because they will be under great pressure to look inwards and revive the economy and not spend money on other countries. And as advocates, we already should be thinking about this and planning for it, because going to them with Gavi or Global Fund, you're virtually going to get no response, because the first thing they'll say is, oh, we've lost trillions of dollars. We're not going to be able to do anything for other countries. How do you anticipate responding to this?
That's a really great question. My mom's over here whispering solidarity.
Do you want me to say something?
Sure, then can I say something?
No, you say something first.
Well, here's my mom and she's in our results group.
Hey!
She has a point she'd like to make and then I'm gonna talk.
Okay.
So for years, we've been making a point that, like going back with polio, the polio anywhere is polio everywhere. And we're trying not to hit that point too hard right now because we don't want people to blame other countries where COVID-19 was thought to originate or something like that. We don't want to fuel xenophobia. We don't want to close borders and things like that. But I think your point is quite valid, Dr. Pai, and I think that we may have to go back to that kind of solidarity look that, hey, if we're fighting it everywhere, that means that it's going to benefit us as well as Canada and UK, everywhere. That was my thought, but Yara has more.
Yeah. So as you mentioned, whenever there seems to be a crisis, whether it's health related or if we're talking about health, but something completely unrelated has happened, it tends to be people's reaction is like, okay, we got to work on fixing our country. We can't think about other countries right now. But there's always going to be a crisis going on. And this particular one, like COVID-19, it's not any country's fault. It's every country's responsibility. And when we're talking about things like Gavi, oh good, she's nodding. Yeah. And so when we're talking about things like Gavi, international partnerships, we're strengthening our whole world. That includes our country, that includes other countries. And talking about like the economic losses for America or for Canada, why should America be spending money? This is something that I hear a lot from members of Congress on all parties across the political spectrum. It's like, we just don't have the money for that. If you think about the entire US budget, a lot of it goes to the military, a lot of it is in Social Security. Less than 1% of it goes to poverty, health-focused foreign aid. It's such a small amount. Like we talked about earlier, Results Canada is trying to get $600 million for Gavi over 5 years. That's way more money than I have, and like that is a huge number, but compared to how much money like the Canadian government has, it's barely anything. And so there's a huge return on that investment for our country, for everyone. So you can talk about countering those arguments from a moral standpoint of solidarity with everyone. You can talk about it from an economic standpoint. It's a great investment. And you can talk about it from a political perspective as well, that we can't have every country close themselves off. That's just not how things work in the era of the United Nations.
Can I also, wonderful points, can I also argue that we should turn this whole thing around and say COVID-19 is precisely the reason why we should be investing in all countries, especially the less fortunate ones, because if they had good universal health coverage, if they had decent public health systems, if they had diagnostic capacity, if they had public health, then COVID-19 could have and should have been prevented before it became a pandemic, right? So, and COVID-19 also tells us there is no corner in this world where we can hide. In other words, we cannot simply think that we can be healthy in our little corner of the globe when there is major illnesses, whatever it's polio, Ebola, I don't care what it is. Disease or ill health anywhere in the world is ill health that we should be worried about. And so I completely agree. And I think we should proactively work on messaging so that I'm just worried that many countries will use COVID-19 to become more racist, more exclusionary, anti-immigrant, building walls and borders, cutting back foreign aid, and just doing bad stuff that they think they now have a license to do. So we need to proactively work on mitigating this damage in addition to all the other damage that we need to fix for each disease area or each source of funding that we care about.
Yeah.
I absolutely agree. Oh, sorry, Summer, go ahead.
I was just kind of thinking, like, each policy member all over the world and different sectors and stuff, every source of decision making, every person has different things on their mind. If they're thinking about the health aspect of it or the economic part of it. So if we want to change their minds, we're going to have to know who we're talking to. What group, what do they care about? And I mean, everyone should care about this. I feel like there's everyone, I say everyone a lot, sorry. But people have a lot on their minds, and it shouldn't be, but it is our responsibility to remind them about other people who aren't to blame, but can use our help.
Yeah, that was good, Summer. I just wanted to mention, I thought it was very funny when Dr. Pai brought up how COVID-19 is the reason, and then all the people with their cameras on just nodded really enthusiastically. When it comes to getting ahead of this narrative, because it seems like the people who wanted to spread racism were definitely on it right away as soon as coronavirus appeared, and we were kind of slow, but we need to catch up, and that comes with every individual person on this call. If you have social media, just talking about it in a way that I suspect I've seen a lot of you already talking about coronavirus in a way that promotes partnership and equity. Like that's something all of us can do. And then beyond our personal behavior, we've talked about advocacy already. You can write in the media and you don't have to be an expert, just talking about it more. That can really help to reshape the narrative. And then on a global scale, we're not going to be at the Gavi pledging conference. We're not going to be, well, not all of us will be on the floor of the UN or Congress, but if we talk to the people who are, we can get ahead of this. Yeah.
This is no joke, right? So I just was writing a grant proposal for an emergency funding for COVID from my university, but it says money should ideally be spent here, and I should strongly justify why I need to have my international sites for my research on COVID. And I'm for a minute thinking, what are these people thinking, right? I mean, here is an example of a disease that is already pandemic, and I'm being asked why I should even spend the money in India or South Africa, which just tells you what we are up against, because the thinking immediately becomes nationalistic, as it has already become. And if we don't counter this, it's going to decimate all funding for low and middle income countries in the coming years. So I love the discussion. In fact, I would ask Yara, if you, Summer, anyone else who is online and excited about this, if you could write a blog post on why COVID-19 is precisely the reason why we need to amp up international aid and invest in global health and not scale back despite the economic losses, I would be very happy to help you get it published in a very good place. Okay? So think about
My
it.
mom is laughing over here because I just started a blog, and that's where I'm going to share the recording for this webinar, by the way, to Florence.
No, that's all fine. But
Yeah.
for this particular piece, I want you to proactively start off by saying COVID will be used by politicians to kill foreign aid investments in low-income countries. And COVID is precisely the reason why we should not be doing it. And here are the reasons why. I will be thrilled to help you get that published in a really good high-profile place, because I'm very worried that if we don't get ahead of this, we will be playing catch up for many years to come. Just like I'm trying to be proactive in mitigating COVID damage on TB, I think each of us should try and get ahead of this. I already saw tweets from Canadian politicians saying, kill international aid, spend more money in Canada. It absolutely boggles my mind that this is already happening in a sensible country like Canada. You can only imagine how worse this is going to get in many European countries. I mean, this is like an open ticket for racist governments and provinces, okay? There are provinces like where I am living now, where they're saying don't accept international students because of the COVID epidemic. Absolute bullshit stuff is happening right now, and we have no choice but to call out this bullshit as early as possible. Otherwise, a year from now, we will have nothing to work with, okay? So let's write something together. I'm happy to join you, or if you write it, I'm very happy to get that published for you.
I have it written in my planner. I got it.
We're all in online school. We have time. Yes, all your points are very good. By the way, I didn't mean to just laugh about that, but some are in her planner. Yes, absolutely. I know several of the people on this call, Arushi, I don't mean to call you out, but like she's been writing things to get on top of this. Like all of us have the opportunity to write, and we have access to newspapers, journals, our own blogs. It's great. Yeah, is Sri still on the call? Because he is this media wizard. Yeah, I don't know where Sri is, but oh, there he is.
Hey, I'm here. Sorry.
Yeah, Sri, what would you tell them, so it's not just me talking, that we can write letters to the editor, and it's very awesome to do?
Yeah, letters to the editors, I think are great. I think that once you sort of get the hang of them, they're really simple, and they're really quick to do as well. And they're actually really effective. Not only are, first, when you send it, the editor reads it. So someone who's part of the newspaper, reads it. Then on top of that, when it gets published, the public will read it. And then, a majority of Congress people, if not all, will actually go through every day and sort of look up all the articles that contain their name in it. So if you're putting a specific ask in your letter to the editor talking about, urging a congressperson to sign off on a bill, they are likely to see it and actually, put it into their filing system or database, wherever they put it. So, letters to the editors are great, and I urge, everyone to at least try them, because they're really open-ended. You can really write about whatever you're passionate about. There's no, specific boundaries or restrictions.
Yes, thank you. I'm glad someone else can back me up on that too. I have a question for the whole group. We talked a lot about global health advocacy, but we also talked about advocacy in general. And so I'm wondering, and we can definitely get back to talking about global health after this, but would anyone be interested in like a part 2 sort of webinar about climate change for this? Because as Dr. Pai mentioned, that's an area that is definitely of interest for young advocates, and we need to know our stuff. Yes? I'm saying yes. Okay.
Absolutely.
Yay. I wanted to do it, but I wasn't sure if other people want that. Okay. I've seen people saying yes, so thank you.
What about the COVID epidemic kind of made it look like young people don't give a damn, that they're partying on the beaches of Miami. They're not taking social distancing seriously. It kind of had this really weird media play that young people are kind of blissfully ignorant of what's happening and they're just having fun. So it's really important, I think, to counter this, and also to say that now is a time where voting, for example, is spectacularly important. So what is it that you folks are thinking or doing about getting more people to go out and vote so that we don't end up with some really bad people in Parliament or White House?
The question is mobilizing voting?
Yeah.
Yeah, so like the generations that are usually referred to as like Gen Z and Millennial, we're making up, at least in America, like the biggest voting bloc this year. And we have a presidential election. It's very important to mobilize voting. This is an issue that, as a person who cannot vote yet, I think about a lot because I can't vote. It forces me to take actions that will mobilize more people, which I think is a good thing, because if I was able to vote, I would just vote and that would be it. But we can do lots of things, and this is for a lot of different organizations. We can do things like, we can't canvass right now because we can't go outside, but phone banking, a lot of organizations are doing that. It's when you get connected to a system that you can call registered voters and ask them, like, who are you planning to vote for? Have you heard of this candidate? And each candidate kind of has an area on their website where you can volunteer. So volunteering for candidates you believe in is great. Talking to your family members and encouraging them to vote is really important. And I know there's an organization called Students Demand Action. They work on gun violence stuff. A big thing with them is doing voter registration drives at high schools or hosting virtual voter registration drives. Even if you can't vote, we can definitely mobilize other voters. And this is something that happened in America in 2018. We had, like, halfway through a presidential term, we have the midterm elections. We had the highest youth voter turnout ever because of these organizations mobilizing. And I really hope that that'll happen again for 2020.
You're gonna demo phone banking on the next call?
Oh, yeah. So if we do a climate change one next time, I was kind of brainstorming what the sample action for that would be, because a lot of us would be like doing this one and the next one, so we don't necessarily need to do phone calls again, but I can demo some of the election stuff on the climate change one, because a big push for groups like the Sunrise Movement and other climate advocacy groups is we need to make it an election issue. Yeah, that's my thing about voting. And everyone who can vote, vote, do it.
Absolutely. If you don't want to have what's happening in US and UK right now, you better vote.
How's Canada?
Canada is, we kind of dodged the bullet recently. Could have been worse, but we barely dodged the bullet, which is another reason why if you don't vote, then really bad things can happen.
Okay. It's about 6:14, and we said it would be a 1-hour webinar. So if people want to stay and keep asking questions, that's great. I'm really liking the conversation here. Otherwise, like, it's okay if you have other commitments to go ahead now. And the recording will be shared on my blog. That's teenadvocates.blogspot.com. Bye, Willie.